Rihanna TV. Watch all you want.
Hello, welcome to the Apple session with Vinolia Sena. Here with me today, I have one fine lady who has been on the internet earlier this year, and she went viral for an action she did. That was to deliver a set of twins in a taxi. So we are here to ask her how the feeling has been like ever since. Good day, Miss Juliet.
Good afternoon, my dear.
How are you?
I'm fine. How are you?
I'm also good. You're looking beautiful.
Thank you.
Thank you. So, earlier this year, we saw videos of you in a taxi delivering a set of twins. Miss Juliet, how has it been like for you ever since?
It's been okay. Just a little overwhelmed since I went viral. But everything is okay. Actually, one was delivered in the washroom, and the other one was delivered in the taxi. That was when we were on our way to the hospital. Yeah, so that's what happened.
Wow. So it actually began in the washroom.
Yeah.
So were you there at that moment?
No, I was in the house when a neighbor rushed to call me. That's they live around our area, but it's a little bit far from our house. So a neighbor came to our house and was like, "Sister Ata, please, you have to come and help us in Chi."
Okay.
Bra Isaac, you're in the air. I said, okay. So I just rushed there.
You stopped doing everything?
No. I was about to even eat.
Oh.
So I had to stop everything and then rush to the place. So I think when I got there, she was in their washroom. She was just lying in their washroom.
Helpless.
Yes.
Oh. A noble profession indeed.
Yes.
So you have to let go of everything you had just to save her life.
Yeah.
God bless you.
Thank you.
So, were you with any equipment at that moment?
No.
No delivery equipment?
None. You see, I was in the house, I was about to eat. So when the neighbor came to call me, I had to rush to my room to take to check if I was having gloves. Okay. But unfortunately, I was only having one. So I was running to their house, and then the neighbor called like, "Oh, sister Atame, well, gloves need to be with you, and I said yes, I need it, and then you should add poly bags just in case the glove was not enough. So that was what happened. I didn't have anything.
Wow.
Yeah.
So in the washroom, you had to carry the baby into the taxi. You said she had already delivered one.
No. When I got there, the first baby was in perineum, like she was just coming out.
Oh, okay.
The first baby was just coming out, so I had to put the first baby onto her tummy. But when I got there, I was like, after the first baby had come, the tummy was so big. So I asked, Sister Ajay, she was like, yes. And there were a few neighbors around too. She was like, and I said, oh, okay. Then you have to lie down for a bit, because for twins gestation, it takes some time before the second twin comes out.
Okay.
Yes, they just don't come together. Yes.
Like how many minutes interval?
So sometimes it takes 30 to 1 hour, or 30 to 45 minutes.
Really?
Yes.
Wow. We thought maybe they come at once.
No.
Hey.
So
that won't she go through any pain?
definitely she'll be in pain.
Yes.
Because there has to be pain before the baby comes. You see, there has to be contractions before the baby comes. Yes.
Wow.
Mm-hmm.
Wow. Good. And in the video, we could see that you were looking for a thread to tie something. What was that?
You see, when you're in the hospital settings, when it happens, we use a cord clamp. You see, there is a cord. You see, there was some. Yes. You use that cord clamp to clamp the cord before we cut.
Why do you do that?
To prevent bleeding. You see, when you cut, it's like the navel. So
is that the umbilical cord?
Yeah, that's it.
Oh, okay.
So you don't have to cut it. You have to clamp before you cut. By that time, I was not having any hospital equipment, so I had to improvise and use a thread. So the thread helped me.
Creativity, as it speaks, as innovation. Oh, wow. The nursing fraternity and maternity are saying they are proud of you.
Thank you so much.
Very proud of you, because it's not easy.
Yeah.
The braveness. Where did it come from at that moment?
This,
weren't you scared?
no, I wasn't. But when I got there, you see, I forgot everything I was doing. I just needed to save her and the babies, because at that time the lady was bleeding. So like I forgot everything. You see the gloves, one got wet and it was torn. So I even removed the first my left gloves after delivering the first twin. So you see, you can't cut the cord because I was not in a hospital setting, because sometimes twins share the same cord. Me and my sister, we had the same cord.
Okay, so you are a twin.
Yeah, I'm a twin.
Oh, okay. So Juliet here is a twin, and she delivered a set of twins. She's blessed. So let's continue.
So I didn't cut the first twins cord because I didn't know anything about the lady, whether they were having the same cord or different cords. So I just had to improvise something there and there. So like after the first one had come, I made her lie down a bit to see if the second one would come, but the baby wasn't coming. So I told the husband to go and prep a taxi, just a standby in case of anything. We just rushed them to the hospital. So after the taxi had come, we were there for some 10 minutes, 15 minutes. It wasn't coming. So the cord was inside. The first baby was in my hand. So I asked some of the neighbors around to help me carry her up, and then I held the baby, the first baby, like this, and then the cord was still inside. So I had to let her walk gradually. And from the house to the where the taxi was, it was a little bit far. So I had to bend down like this, take the baby in my hand, and then walk backwards. And then the lady will walk gradually towards the taxi. So I made the husband prep the taxi. Like she has to use the what do you call it, the mats. They have the Louis mat. So she has to cover the taxi seats with the mat in case of any bleeding and any fluids. It doesn't stay in the taxi driver's car as well. So after they had done that, we just walked gradually to the car. I laid her back, and then I placed the first baby on her tummy. And I asked the husband to sit so that the lady can rest the head on him. So that was when we were in the taxi, and then I told the driver to be fast a little so that we go. But as we were going, she was like, "Sister, Taemia." So I was like, I'll make the taxi driver wait, and then I'll do the second V. V means like vaginal examination. I'll just check and see if the second twin is coming. So we did that one. He was not coming. We went a little bit. So like we moved for like a little bit for 5 minutes.
5 minutes.
And then she was like, "Sister, So at that time we were nearer to the roadside. So I made the taxi driver park.
Again.
And then again. And then I checked. At that time I was having only one glove. So I used my right hand, and then I did the V. That was when I saw that the second twin was coming with the legs.
Legs?
Yes.
It was going to be a difficult moment.
Yes, so it was a breech bed. And then the lady was in pain, so she couldn't say anything. So I just prayed in my head there and there, because breech presentation is a little bit difficult. It's not a little bit, it's very difficult because doctors always ask for like, what do you call it, the CS to remove them. Yes, so it was difficult. So I just prayed in my head. I was like, "Jesus, please, you have to come and help me here," because I was just thinking of the mother and the babies, not myself. Because
at that moment
I had forgotten. I was not even wearing gloves. I had forgotten everything. So I was just praying.
Your mind wasn't even there.
So God being so good, the second twin came, but with
On
the
the
legs. Yes, on the way. That was when we were in the taxi. The second twin came in the taxi. So he came with the legs. By God's grace, I was able to deliver the second twin.
You've really done exceptionally well.
Thank you.
That's very good. So I want to ask, when you got to the hospital, what did the doctors do, or the nurses? How was it like?
So when we got, like, after cutting their calls, you heard me in the video saying Pachomamia Humani Blade. Yes. That was that. So after we went to the hospital, I took the twins. The lady was lying back in the taxi. She was bleeding now. So I told the taxi driver to like blow the horn and then speed up so that we get to the hospital fast. You see, like when we got there, I rushed the babies to the maternity ward, and then I asked the nurses. I just delivered my neighbor, so she's in the taxi bleeding. They should come down and help me bring her up so that we set everything up.
Were they fast enough to help?
Yeah.
Hey, with this smile.
Oh yeah, they were fast enough.
Oh, okay.
Yeah, so they help. I also help. I was there with them. They did so well. They didn't tell me to go out. Like, I was there with them throughout. We set the line together.
Did they know you were a nurse at that
They
time?
didn't at that time, but when I told them, I think one of the nurses knew me.
Oh, okay.
But we were all busy at that time,
Yeah.
so we couldn't even see which person is another like that. So we were just in the. I was setting the line. The doctors were there. The nurses were there because she was bleeding profusely, PPH. So we had to act
What is
fast.
that meaning?
Postpartum hemorrhage, like
okay.
after bed bleeding.
Oh, okay.
So it was.
Can somebody die out of that?
Of course, yes.
Oh.
This lady was dying.
Yeah,
It was
because
only God.
Come out with the legs.
Yes, she was bleeding profusely, so we had to act. We didn't like we had to act fast. So you see, God is good.
Yeah,
Yes.
indeed.
And everything
Well
was
done.
so fine.
So this is your first time of delivering a set of twins,
Yes.
or even delivering a baby,
Yeah.
because you are a general nurse.
Yes.
Your field is not in the midwifery field.
No.
Wow.
No, but I've been watching my midwives do it, so
Okay.
like I have a fair idea about
of
it.
it.
Yes.
You're a smart learner.
Thank you.
Oh, that's very good.
Thank you.
Right, so we've heard all about Miss Juliet's experience, her ordeal in delivering a set of twins. She's done well. She's never done it before, and this was actually her first time of doing it. So we can say, at least those who stay around here, she can be their next midwife. Let me put it that way. Yes. So, Miss Juliet, can you give us any word of caution, because to deliver a baby whilst you are not a midwife, you have to know the do's and don'ts.
Yeah.
As we were saying, you weren't with the gloves.
Yeah.
You were posed for an infection at that moment,
Yeah.
because it's very risky.
Yeah.
Blood contact is very risky. So can you give us a little advice on what to do at such instances?
Yes. You see, the first delivery, which was the first twin, that was in the house. So that one I was having gloves, both hands. But the second one, which was in the taxi, I thought like we might get to the hospital before the second twin comes. Because when I did the V, I saw the baby was coming with the legs. So like I was just praying in my head that the second baby should come in the hospital. Yes. But you see, when you are called to do such things, initially when they called me, I was like, please give me a polythene bag. So you can improvise with that if there is no gloves. And then you see, we weren't having a cord clamp because it wasn't a hospital setting. So you just have to use the thread. The one they used to braid the hair, the thread, yes. You just have to tie the cord very firm and then hard before you cut to prevent bleeding.
Is it only bleeding?
For-
Maybe air?
Yes, it's true. Air can also enter. So you just have to be very cautious.
Is there any infection?
Infections, yes. Infections. So after you had, like, in case you are called to do such things, you have to send the mother and the baby or the babies to the hospital immediately we are done. That was why I told them to get a taxi ready. Because after everything, even if she wasn't bleeding or everything was okay, I would have still taken them to the hospital. Yes.
For some little
Further
checkups
management,
or-
of course.
Okay.
And then the kids have to be injected. The mother. a whole lot of-
Injected? Why?
Yeah. Yeah, when the baby comes out like that, we have something we put on their eyes to
What
prevent
is it?
infection.
Okay.
Yes. You see, because they are coming out, you don't know what is there, the fluids and blood, everything. So you have to put something on their eyes. You have to inject them. Yes.
What of the mother?
Yes. The mother.
needs
Yes,
injection.
injections.
Usually
And
when
then
some of them give birth, some say they develop blood pressure afterwards.
yeah, some mothers, when they are pregnant, they tend to have pregnancy-induced hypertension.
Okay.
Yes.
What is that one too?
So you can be pregnant due to the pressure and then what do you call it? There are certain circumstances, some people, not all of them, when they get pregnant, they tend to have hypertension. Yes. And then some too afterwards. So you just have to be in a hospital for regular checkups, for your medications and everything. So that's why you have to send them to the hospital after everything. If you're even if the person delivered in the house, the person has to be in the hospital for further management. Yes.
Alright, still on the Apple session with Miss Juliet, a fine nurse who delivered a set of twins in a taxi. Yes, she's been in the news for weeks now. Miss Juliet, for how long have you been working as a nurse? We know you are not a midwife.
No.
Good. So for how long have you been working as a nurse?
Okay, I've been in OMG Health Center for like a year and a half now.
Okay, you were posted recently.
Yes, for a year and a half now. But I've been working in my uncle's hospital. That was in Kumasi. So after university, I did my rotation. I started with the Ku District Hospital, and then I went to work a little at Lighthouse Hospital in Kaneshi. But I wasn't that. I worked there for some few weeks. And then yes, before I went to my uncle's hospital. This is Washington Memorial Hospital at Kumasi Dichemso. So I have a lot of experience there before I was posted to Obum Health Center.
Where are you currently working?
Yes,
now?
that's where I currently work.
Okay. All right. So, Miss Juliet, can you give us a little submission on nursing in general, and then delivery in general too, and then a word of advice to our junior nurses who are our trainees, those who are learning now, and those in the field already? Because most of the times people go about spilling, excuse me to say, using bad words against nurses. The nurses are these, nurses are that. But you know, you've made a standard because of what you showed the level of, let me say, some kindness, and you exhibited the nursing profession. That's the noble profession, yes, because it's a calling.
Yeah.
If you're not called to do it,
Okay.
in this circumstance, you could have said, "Me, name family." You see, but you laid all those aside, and then you focused on life.
Yeah.
You've done really well. So give us a little submission on
Thank
what
you.
you tell our nurses out there.
Okay. So to all my nurses, my midwives, and then all the general nurses as well, we just have to be patient. We have to learn very hard, because like you don't have to say I'm a general nurse, so I can't do this. You have to, like, there are certain circumstances you just have to help the person. Okay, so you have to learn a little bit about every field, any jiffy, any minute you get. You just have to read on any chance you get. You just have to read a little on something. You have to be submissive, like you have to calm down to everybody's level. You have to be patient, loyal, respectful, and then God-fearing as well. You have to be committed to your work. Because if you are not committed to your work, there are certain things you might not even do. Accidents, see. Now we go for to trap pictures. Instead of you to go and help, you never help, you just pass by. But if you have some passion for your job, for human beings, there are certain things you will do. So I'll urge all my nurses and my midwives, my colleagues, that have to be patient and then have some submission to our job. And then God will help us. God will bless us. You don't, sometimes patience will add some way to you. You might be even furious and things. But we don't have to look at the patient, what the patient is doing. You just have to be courageous. You just ignore what the person will do. Yes. And then focus on what you do. Thanks to all my friends, especially my twin sister who made me go viral. I didn't even wanted to post this. She was the first person I sent the videos and everything to, because the taxi driver had videoed everything. So afterwards I told her like, hey Kaka, I can't believe what I did today. God is so good. So I sent her the videos. She also did not post the videos. She wrote on her status like, I can't believe what my twin sister did. She delivered a set of twins today, one with the breech birth. Everything was fine. Thanks be to God. Blah blah blah. So other friends saw it on her status. Ivekia Bedu, thank you so much. Marvelous, GHPH, a whole lot of my friends. Akafari Benedicta, Grace Ohinewa, there are a lot. All of you know yourselves. Thank you so much. I can't mention all their names because of the time. Thank you so much. God bless you all for making me go viral. Thank you.
It's been a good one here with Miss Juliet, and we are very grateful for making time with us and then teaching us a lot.
Thank you so much.
Our viewers out there are saying God bless you.
Thank you.
And we hope for more opportunities, bigger opportunities for you. You go international.
Amen.
From this interview, we promise you're going international.
Amen.
So it's Priyana TV and the Up Close with me, Vinolia Sena, your host. Don't forget to subscribe to our YouTube channels, follow us via Facebook. Priyana TV, watch all you want.
Priyana TV. Watch all you want.
We leave the choice to you to tune in and station to the best TV station, that's Piano.